Hi, I am Professor Long, and my thoughts on nursing theory are that you should have one.
Hi, I am Professor Briosa Wang, and what do I think of nursing theory? When I think of nursing theory, I think of Sister Callista Roy, because she was the theorist that I had to base this big thesis that I had to do in my master's program. But I love her because she's easy, adaptation, we all have to do it. There you go.
Hi, I'm Professor Mariana Turiani, and I think your nursing theory course is the second most important course, second only to evidence-based practice course. Now the two go together very nicely. You need both. You can't have one without the other. I also have to say I like Dorothea Orum's theory. The self-care theory really makes a lot of sense to me. It may be, though, because my undergraduate professors really drilled Dorothea Orum into me when I went to Georgetown many years ago. It was all self-care theory, but I do think and use many other theories all of the time. They are really a help, so learn them well.
Hi, I'm Professor Acton, and I love nursing theory, and my favorite theory is nursing related to caring. Thank you.
Hi, I'm Professor Radford, and I'm talking about nursing theory. I think the benefit of studying nursing theory is that it teaches us how nurses have seen us over the generations and how that's evolved, how as our role has evolved, different theories develop or different aspects of nursing appear. I don't think we have not yet developed our overarching theory. There are moments that I am absolutely in love with one theorist or another. I think a mistake we make in nursing theory is that some nurses have developed huge, grand, overarching theories, and we try to apply them in a specific situation, and they just don't work that way. I think it's worth the study because it's kind of, think of it as mental gymnastics. You're much better after you're finished.
Hi, I'm Professor Reifel. My theory on theory has to do with children, and I think that studying childhood theory will help parents be better parents and to help raise children in a better way.
Hi, I'm Professor Madden, and I used to think nursing theory was a real snoozer when I took it as a course, and then I began to really learn about Jean Watson and began to apply her in my own nursing practice, and it was like a seed that was dropped into fertile soil, and it just blossomed and it just exploded into something very real and something very meaningful to me. And so suddenly now I understand how her theory provides a framework for how nursing works for me, and it's changed the way I nurse. And if I were to say one thing about Jean Watson, for example, is that for her, the essence of nursing is when the patient and the nurse have that one moment together where they actually connect, and the nurse is able to speak somehow in a way to the patient, or the patient speaks to the nurse in a way that's truly meaningful. And that's what nursing is to Jean Watson. And I totally get that. I really think that's true. And bam, that's nursing theory. It's not some book that's like, it's like, no, it's something really real at the bedside in your life. That's what I think.
My name is B. Phillips, and when I think about nursing theory, I actually think about the way that I practice on a personal basis. And I think it would behoove any individual who wants to become a nurse to look at the different theorists, to look at what their value is, and find out what it is or how it connects to you as an individual. And then you'll be able to understand nursing theory in particular and what that is going to mean for you as a clinician as you guide, as you work through and work with your different patients and clients and even your colleagues. And it will help you to become a more rounded, I feel, individual, as it has done for me. Even thinking back to Florence Nightingale and the fact that cleanliness is next to godliness. And who would have thought that those little bitty germs that we can't even see would cause so much of a problem and be so difficult for our clients. So when we realized that, then we were able to really come up with the inclination that our clients really need to be clean in a clean environment, and that will help them to be better. So theory is knowledge, is definitely a part of your everyday being a clinician and caring for our patients.
My name is Professor Parker, and I really enjoy teaching here at Centera College. And nursing theory, it guides our profession and our own nursing journey. It supports our efforts towards autonomy, and it makes us feel empowered and engaged in our work. My personal favorite is Dr. Jean Watson's caring theory.
Denise Foster here. My take on nursing theory is that everyone has to start somewhere, and for us it starts at the nursing theorists. You build your foundation of nursing on the nursing theories that are available, and so you're going to see nursing theory strung throughout your courses, but more importantly, you should be stringing nursing theory throughout your professional practice. My favorite theorist is Sister Callista Roy and her adaptation model, because you will be learning to adapt to many things in your nursing career, so good luck.
Hello, my name is Professor Johnston, and my take on nursing theory is the fact that we need to make it important because it's the basis of what we establish our own personal practice on. You can reinforce all the decisions that you make in a clinical and professional environment by living a little nursing theory, so incorporating where you can.
Okay. My name is Sharice Kelly Broadway. I'm an e-care e-learning training specialist for clinical education. And my take on nursing theory is it's kind of the skeleton of nursing practice. It sets the foundation, and from that foundation, you just build on it every second that you practice as a nurse.
Hey, I'm Georgianne Poole with Centera College of Health Sciences, and I've just been asked the question about nursing theory and how I think it pertains to nursing. When I think about nursing theory, I think about how it guides practice. It uses concepts that are based on different nursing models. It helps to generate further understanding and knowledge with nursing, which the nurses are exposed to so many different roles. So theory, whether it be Watson, Orem, whoever, I think it helps to guide the student. And that's how I feel about theory.
Okay. I'm Amy Ewald, and the theory I'm thinking about is Patricia Benner's theory, from novice to expert. There was one time on our clinical unit when we had a lot of new nurses coming in, and so we sat down and had a meeting, and we went over the theory from novice to expert so that we could remember how a new nurse thinks and how they grow into an expert nurse. And this helped us to accommodate all the new nurses that came to our unit, and it helped us to support them and helped them through their first year. And then they were able to grow a lot better and feel a lot more comfortable on our unit.
Hi, I'm Dr. Banks, the Program Director of the RN to BSN program. What does nursing theory mean to nursing? Nursing theory is the underpinning and structure of nursing, trying to define phenomena in which supports the care that is rendered to clients. Thank you.
Hi, I'm Shelley Cohen, and I'm the Dean, and I was privileged to write a paper and to talk to Sister Callista Roy. I found that she had the most simplest and easiest theory to adapt to my own practice.
Hi, my name is Tracy Johnson, and I am the program director for the Care Partner program. So the first time I really can remember learning about nursing theory is when I did my BSN program many years ago. And the theorist that I really remember identifying with in that is Patricia Benner's novice to expert. And what I like about that theory and what I like to apply and use that theory in practice today is that even though now I'm a nurse, I've been a nurse for well over 20 years, if I were to change jobs and go to a new job, I'm no longer the expert in that job, and I'm now somewhere in between being a novice and being an expert, because I can utilize all of the things that I've learned in my life and all the experience I have. But if I went to CHKD, for instance, I don't really know about taking care of babies. So as far as being a pediatric nurse, I would be a novice. And so that's why I really liked her theory, because it talked initially about new grads and then how we move into more expert positions. But it also talked about how we can fall back into that novice role, or yes, as we move on into different field and careers.
Sure. Hey, I'm Cindy Hurd. Back in when I was in nursing school, I did choose a theorist, and the concept was holistic care. I do believe that the patient, we should treat them with respect and use every aspect of their care, not just the physical care, but their holistic, their spiritual, their emotional, their mental, and that has helped me in the not 27, but since 1998, when I've been in nursing, to care for my patients. I always have that in the back of my mind, no matter what their background is or their culture. I always care for them holistically, so capture the whole patient. So I hope that helps. Take care.